Hello and welcome to this series of interviews with British Cardiac Society officers. My name is Caroline Coates. I'm a British Heart Foundation Research Fellow at the Heart Hospital in London. I'm delighted to be here today with Professor Derek Yellon, who's Vice President for Finance and Corporate Affairs at the British Cardiovascular Society and Director and Founder of the Hatter Cardiovascular Institute at UCL. Professor Yellon, thank you for coming to take the time to talk to us today. Can I start by asking you about your early career and how you came into cardiology?
Well, my career developed when I was in South Africa. That's where I grew up, and as a boy I was always interested in research and finding out things in biology and what have you. And then after my first degree at the University of Cape Town, I came to the UK. This was in the mid-70s when there were problems in South Africa, and I came to the UK very keen to continue my interest in pharmacology at that stage, and was fortunate enough to undertake a PhD degree at the University of Bath in cardiovascular pharmacology. So straight away I was interested in pharmacology and managed to do that, and that actually led me into the cardiovascular arena. And from there I then went to St Thomas's Hospital to do a postdoc fellowship in the same area in cardiovascular research. And it followed on, and I spent a number of years there before I was invited to University College to set up the so-called academic department of cardiology in the early 90s.
And I know you were the founder and the director of the Hatter Institute. How did that come about?
When I came to UCL and UCLH in the early 90s, the idea, we found some space to develop the academic department, and I was very much into basic research as well as clinical research, and I wanted to develop a translational department where we went from bed to bedside. So to me it was very important that the research facilities were in the hospital as opposed to the college, and UCH gave me space, and we decided I had to raise the funds for a lot of the building works, etc. And to cut a long story short, a patient of my colleague, Dr. Walker, was Sir Maurice Hatter, and he's been very supportive and helped us, and I decided then we should develop this and create what I call the Hatter Cardiovascular Institute, which has sprung from virtually nothing to an international Institute for Cardiovascular Research, which I'm exceedingly proud of.
Do you think research is essential for clinical cardiologists or just those aspiring for an academic career?
For a clinical cardiologist, I think you have to understand, it doesn't matter if it's basic or clinical research, you have to understand the fundamentals behind what you're doing with your patients, and if you can get a training in research methods and understanding and questioning, that makes an enormous difference. So, I mean, I'm very much pro any young budding cardiologist undertaking a higher degree, be it in an early stage of their career or a later stage of their career, just to give them some understanding of what the processes of how they look after their patient and what's behind the pharmacology, the biochemistry, the molecular biology.
Is there anyone that particularly inspired you in your career? One
is never isolated, and I've got a lot of individuals I could think of that have been mentors for me and inspired me. One that comes to mind straight away is Professor Jim Downey from the University of South Alabama, who I worked with in the 80s when I was a postdoc fellow. We've maintained our relationship ever since, and he's been an inspirational force and in the physiology behind what we do. Then there've been many others, and I don't want to sort of pick out specific names because it wouldn't be fair on those that I've missed out. But I think behind your question is that anybody who reaches a certain level must appreciate that others have supported them on the way, and I think it's one's duty then in turn to look and support others that are trying to build up their careers, because the experience you gained should be passed down to others.
Can you tell me how you became involved in the British Cardiovascular Society and a little bit about your role there.
You know, I can't remember how I came to be involved in the society, but it's been a long time. I've been involved with the society, it seems like forever. It's a great society. It's got fantastic people in it. It's very near where I work. And I've been on numerous committees, and now I find myself as Vice President of Finance and Corporate Affairs. And really my role in that, with respect to finance and corporate affairs, is very much looking after the finances of the society, making sure that we as a society, which we are a charity as well, build up our funds, use them for the appropriate purposes such as education. And it's not just me, I've got a fantastic committee that we work with, and with non-executive committee members as well to give us advice. So it's really looking after, making sure that the finances are strong, especially in this economic climate that we live in today, which is quite turbulent. And then getting involved in any other way with the society in terms of raising its profile, etc.
What are the initiatives for the British Cardiovascular Society in the coming year?
I am an eternal optimist, and I think appropriately so, because I think the society's future is great. It's developed into an amazingly professional organisation with fantastic individuals really at the senior level of what they do, both in cardiovascular medicine and contribution to the society. So I think the society will go from strength to strength. We've got fantastic initiatives now with the British Heart Foundation. We've brought our conference, our annual conference, which is the most important thing we do in the year, in-house. Everything's organised from within this building we're sitting in. And all we have to do now is to continue to increase our membership numbers, which are increasing anyway every year.
Finally, I know you're a busy and successful person, but we like to ask everybody, do you find time for things outside of medicine, things that keep you fresh and recharged?
Everybody's busy, and I find plenty of time to do other things as well, because I don't take my work home on the weekends if I can help it. My most important thing is the family. I love spending time with my kids, which are sort of late teenagers and early 20s now. And I read a lot, I travel a lot, I enjoy everything I do, and work is just part of it. Work's a bit of a hobby for me anyway, so I don't have a problem with that. And you know, I would encourage everybody or anybody who's, especially if you've just started your career, to get involved, say, with the society. I think a lot of people feel that, oh, this is for those senior people in medicine or cardiovascular medicine, and it can't be for me yet, I'll wait my turn. I think that's nonsense. I think if you're enthusiastic and you're a young cardiologist, that now's the time to get involved with the society and help. And I think you'd be welcomed.
Well, Professor Yellon, thank you so much for taking the time to talk to us today. It really has been an absolute pleasure.
Thank you.